Hi, Luke Gordon here, and right now where I live, a lot of people are waiting for total knee replacement surgery. Currently, it's just a backlog of surgeries, and with the Delta variant of COVID, our hospitals are getting filled up. So a lot of our clients who are about to have total knee surgery are now waiting, and their surgeries are getting pushed out for months in advance. So if you're in this position, today's video is all about the 5 things that you should be doing right now if you're waiting for surgery. The emphasis on these 5 things is that there are things you can do now to improve your pain, but more specifically, that are going to get you in a better spot to recover faster. So let's consider this period possibly a blessing in disguise, where if you do these 5 things, you're going to have a much higher likelihood of a successful outcome, easier outcome after surgery. So just doing the things you can to improve that. So I'm going to go through all 5 in this video. And then I'll have some links at the end of the video in terms of more specific things. But the first one that you should be doing right now is you should be doing everything you can to strengthen your quadriceps muscle. So the quadriceps muscle is that big group that's on the front of your thigh, biggest group of muscles in your body, and it is going to get hammered during your total knee surgery. Now, if you're familiar with the surgery, you're going to have a big incision down the front of your knee. They're going to have to remove your kneecap and your quad, which is all continuous, and pull it off to the side. There's going to be lots of bleeding. There's going to be cutting. There's going to be all these things that you probably don't want to actually see, but this is how it goes down. So your quad is going to be pummeled, and it is vital for your recovery that your quad gets back to full strength as quickly as possible. So right now, before your surgery, even if your quad is getting weak because you can't do much with your knee, you should be starting to contract your quad, start squeezing it. Do things like straight leg raises, terminal knee extensions, small squats. I'll link this at the end of the video if you want some specific activities, or maybe I'll even link it right now above here. So strengthening your quads, however you can do it without causing extra knee pain right now, is huge for you. So that's number 1. Number 2 then is you want to start stretching the muscles near your knee. And the 3 ones that I would really focus on would be your hamstrings and your calf muscles, and again, your quads. So your hamstrings are those big muscles along, the back of your knee. And your calves are the big muscle, your calves. You want to start stretching your calves. You know where those are, hopefully in your lower leg. Those 2 muscles, the hamstrings and the calves, cross the back of your knee. And after surgery, when you're working on getting your knee to fully straighten, which can be really hard to do, if those muscles are already lengthened and loosened, it'd be much easier to regain full knee extension, full knee strength, or straightening. So those are the first 2. The third one is your quad. Most folks, even in their outpatient rehab after total knee surgery, don't ever stretch their quads. Now, I just told you that your quad gets pummeled. It gets really hit hard during surgery, and it's hard to stretch, so most people just don't do it. If you're going to stretch your quads, I can't really show you in this close-up video, but you're probably going to need some kind of a stretching strap with loops, and you're going to want to loop that over your foot. I need to make a video on this for you soon, but you're going to want to stretch your quads somehow. So lay on your stomach, get this pulled over your shoulder so you can bend your knee and really try to stretch out the front of your quad there. So that's number 2. Stretch those 3 muscles, your calves, your hamstrings, your quads. Get a jump start on the fact that these muscles are going to be irritated after surgery. So that's number 2. Number 3, let me check my list here, is, I believe, ride a stationary bike. This is an easy one. A recumbent bike usually works best. At this point, if you're having total knee surgery, it may not feel that great to go for long walks, although if you can, or if you have access to a pool, go right ahead. Riding a stationary bike is one of the best things you can do just to keep the joint lubricated for now, and to keep all those soft tissue structures as loose as possible, and then also to keep the blood flowing and keep some level of strength and tone up in your leg. So quads, calves, hamstrings, hip flexors, all those muscles, glutes, they're going to benefit from a recumbent bike. So if you haven't got onto it yet, go on Craigslist, go on Facebook. Even if you only want this bike for the next few months, start riding a bike. That's number 3. Number 4, and this is a big one. These next 2 actually are probably arguably more important than the first 3. The number 4 is, if you have swelling in your knee already, and the swelling is pooling, especially like into your lower leg and your calf, you should try to get that swelling out before surgery. Most folks make a huge mistake and they wait until after surgery, when again, your quad is pummeled, the muscles have been moved, the blood vessels have been torn, the bones have been sawed, and all these things, and now you're dealing with a massive increase in swelling. If you can clear any of that now, clear it out of your lymphatic system, get it back into good circulation, it'll make your life much, much easier after after your knee surgery, when you're again looking to get full range of motion and full strength, that swelling can be a huge factor. I've got another good video on how to get rid of swelling after surgery. I'll pop that up right here and probably link to it at the end of the video as well. It's a huge thing to get on top of right now before surgery. That's number 4. Number 5, not 10, 5 is if you have ongoing pain, get on top of it now. Now, obviously, you've got knee pain. That's why you're about to have total knee surgery. But if you've got an IT band issue along the side of your thigh, you've got muscular pain somewhere in your calf or your hamstring or quad, you've got a bad hip, you've got hip bursitis on the outside of your hip, or you've got piriformis or sciatica, any of these things that really probably have a life of their own at this point. If you can get on top of any of those things now, it's going to make your life a lot easier after surgery, because you just want to be able to get through surgery and then focus on your knee. Here's your knee. Okay, how's your back? My back is good. How's your hip? My hip is good. Great. Let's focus on your knee. So again, any ongoing pain, I would say especially low back, hip area, buttocks, IT band, anything like that. If you have soft tissue pain that you can put your fingers on right now before surgery, get rid of it. Get in to see your PT, your massage therapist, your chiropractor. Get in to see all 3, your acupuncturist, whatever you can do. Get on top of that pain today. Get on top of the swelling today. Get your strength up today. Get the muscles used to being stretched today. So don't just sit around. That's the moral of the story. Any period of life doesn't do you any good. During Delta variant of COVID, it definitely doesn't do you any good. Keep getting out. Maybe you make enough progress, you can delay your surgery indefinitely. You never know until you try. So that's my message today. Those are the 5 things you can do leading up to surgery. I appreciate you for watching the video. Please like and subscribe before you go. And I do have a written report on total knee replacement surgery as well. I'll link that below the video, like in the description of the video. If you want to check that out, it's on the Gordon Physical Therapy website. Feel free to download that and check it out. It's got more in-depth tips and stretches and exercises for getting ready for surgery. So that's the video. I hope you enjoyed it, and please leave me a comment below, especially if you liked it. Give me some good feedback. I would appreciate that. Thanks a lot.